Hello, my name is David Turnberger, and this is my first peer-to-peer attempt for IV Piggyback administration. Before I begin, for here consecutive throughout my next 5 attempts, I will be using kind of my at-home administration sets that I've built. So back here I have a 250 ml bag of 0.9% normal saline with a Y port, and it's currently attached to my at-home made arm vein kind of thing. Due to COVID, I haven't had a whole lot of time to be able to get into the lab. That's why I've had to make these things at home. Carrying on with the rest of my skill set, I want to make sure that I have my labels for my medications, that I have tape, alcohol swabs, gloves, or proper PPE, that I have my medication, my IV solution, and my administration tubing. So the first thing that I'm going to do is confirm with my medication orders if I'm in a hospital setting or out in the field, just making sure that I have the orders for this medication. I'm then going to talk to my patient and be kind of like, hi, my name's David. I'm going to be the one taking care of you today. Would you mind telling me your name and your date of birth? Perfect. If you don't mind me asking, are you allergic to anything? Do you have any allergies? Okay. After I've determined if they've had any allergies or got their name and date of birth, I'm then going to explain my procedure. So the doctor ordered for you to have another medication going through your IV lines. So we are going to be giving this medication through a much smaller IV bag. I don't have to poke you again. I don't got to do anything else, but I'm just going to be setting up this medication. Is that fine? I'm going to go over and check with my label. All right, can you tell me your name and your date of birth one more time? If it agrees with the label, then I will continue. I will start off by going down with the rest of my 5 rights. So I've checked that this is my right patient. I will check that this is the right medication, that I have the right dose of it, that I'm going to be giving this at the right time, and then I'll be checking sure that I can give this at the right route. I'm going to be checking the clarity of it as well as the expiration date. Then I will go ahead and set up my needle, just kind of speed things up, say that I went ahead and already did that. I will get all the air out of my syringe. I will then go and attach it to my needle. Once I have this set up, I'll grab my Piggyback solution. I will inspect that it is the correct solution, inspect the clarity of it, the expiration date, and that it has both of its tail ports. I'll recheck my medication one more time. I will then take an alcohol prep pad and I will clean my secondary tail port. And then I will inject my medication into the bag. Then I will immediately place this in the sharps container. After I have done that, I will then gently massage the medication to make sure that it is all mixed together. After that, I will grab my IV tubing. I will inspect it to make sure that there are no kinks. I'll make sure that it has both of its tail covers and that my flow clamp is as close as it can to the flow chamber and that it is closed. After I have done all of that, I'll put on my PPE. And I will go ahead and spike my second bag. Turn it upright, fill my chamber about halfway. Okay, then I'm going to try and get all of my air bubbles out without expending as much of the medication as I can. Okay, after I've done this, I'll close my IV tubing back off And then when I go to hang this, I'm going to want to make sure that my piggyback solution is higher than my actual solution. I will then go and recheck my medications one more time, check to make sure that I have everything right. Then after I am done here, I will stop the flow rate on my primary line, stop the flow rate, or the flow rate on my secondary line should already be closed. I will then take an alcohol prep pad and I will clean off my Y port. I will then insert my IV tubing to the Y port. I will adjust the flow rate of my IV of my secondary line to its proper dosage rating. I will tape my secondary line to the primary line. I will then adjust the flow rate on my primary line to the proper rate that it's needing. After I'm finished with all that, I'll make sure to put my label on my secondary IV solution. Then after I have everything all together, I will then monitor my patient for any adverse reactions, any other undesired side effects, or any other irritations to the IV placement. Thank you.